Dr. Terry Wahls is an Institute of Functional Medicine certified practitioner and a clinical professor of medicine at the University of Iowa, where she conducts clinical trials. She is also a patient with secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program she developed. In 2018, she was awarded the Institute for Functional Medicine's Linus Award for her contributions in research, clinical care, and patient advocacy. She is the author of a series of books on the Wahls Protocol, which documents her program. With that, let me start the interview. Dr. Wahls, welcome to Modern Healthspan, and thank you very much for joining us this afternoon.
Yes, thank you.
So Dr. Wahls, I think you have an incredible story. You were diagnosed with multiple sclerosis and confined to a wheelchair for 4 years. And then
Yes.
through your own study, you came up with a protocol and in a relatively short space of time, got back to where you could walk around and ride a bike. And so this is amazing. Could you talk us through kind of
Sure.
that process, please?
So I'm going to take you back in time with me. So, 20 years ago, I'm out walking with my wife and my left leg becomes weak. And I drag it and I walk home. I see my neurologist who says, Terry, this could be bad or really, really bad. And in bed next to my wife, I'm thinking about my zingers, the jolts of electrical face pain that have been going on for 20 years and getting worse. So I'm not wanting to become a burden to my family, and I'm seeing that this is clearly a progressive disorder, whatever it is. So I'm secretly praying what I have is fatal. Now, it turns out that what I have is MS. It takes just 3 years. I'm in a tilt-recline wheelchair. I take mitoxantrone infusions. I take tizabri infusions. I take Cellcept. Nothing helps. And I'm too weak to sit up at my desk. I ordered zero gravity chairs so I can recline back with my knees higher than my nose. And like anyone with a progressive neurologic disorder, I learned to let go of my future. I take each day as it unfolds. My zingers are more frequent. They're turning on. And when they turn on, I involuntarily grunt, grimace. My kids are really upset. My daughter hugs me, trying to, 10-year-old, trying to comfort me, which triggers more zingers. And, I'm gritting my teeth, trying not to scream and pull away from my daughter. So life's difficult. But I'm a physician. So night after night, I go to PubMed and I'm reading the basic science studies. And I begin experimenting on myself. At first, it's supplements. And I slow my decline, and I'm completely thrilled. I discover a study using electrical stimulation of muscles. And I ask my physical therapist, can I try that? He says, Terry, this is for athletes. No one does it for MS. We could grow bigger muscles, but we don't know if your brain could really talk to them. But he agrees to give me a test session. It hurts bad, but when it's over, I feel great. And so I start doing e-stim to as much pain as I can tolerate. And then I discover the Institute for Functional Medicine. I take their course on neuroprotection. I have more supplements. And then I have a really, really big aha. Like, what if I redesign my paleo diet based on all the science that I've learned? And so I've now created a very structured paleo diet. I go back to daily meditation. I am training with my e-stim device like an athlete, gradually increasing, what I'm doing. And in 1 month, I am sitting at my desk. In 3 months, my horrible electrical zingers of 27 years have been getting relentlessly worse are gone. And in 5 months, I stun everyone at the hospital because I'm up walking without a cane. And then for the first time in 6 years, with my son, Zach, jogging on the left, my daughter, Zeb, jogging on the right, I get back on my bicycle. And at Wahls, I catch my balance and I'm biking. And of course, my kids are crying, my wife is crying, I'm crying. And really how I think about disease and health is transformed. Ultimately, I began spending more and more time talking to my patients about diet, about the same kind of lifestyle factors that I'm using.
Mm-hmm.
My chief of medicine at the university gives me the job of doing a clinical trial to see if others could do what I did. And it changes the direction of my career. 10 years later, I received the Linus Award for my groundbreaking clinical research and patient care protocols. And now, literally, I am transforming the lives of millions all around the globe, restoring their hope for a better future. And it's so exciting. It's hard to sleep at night. I have to really work at meditating because what I'm doing is just so exciting and so exhilarating.
Right. It is amazing. So multiple sclerosis is the myelin sheath on your nerves is
right. So the immune cells are damaging the myelin, and the myelin is the insulation between the nerve cells or the wiring. That breaks down. There appears to be more rapid loss of brain cells, more rapid atrophy of the brain, the spinal cord, and this early death of neurons or brain cells. Probably mitochondrial dysfunction, probably excessive inflammation in the brain and in the bloodstream. And of course, it's really a multifaceted, many factors contributing to this. And you see, what I do that is so innovative is I teach people how to create health. And by focusing on creating health, we slowly rebalance many biochemical processes, which calm the inflammation, which restore the mitochondrial function, which reduce fatigue, improve mental clarity, reduce pain, and if people will then begin exercising, lead to also improved motor function as well.
Right. Yes. So I'm really impressed that you could read. I mean, while you're having multiple sclerosis, I mean, which must be fairly debilitating, to be able to read these PubMed articles and really.
Well, it was hard. At first, when I first started reading this basic science, it was hard, and I started doing that in 2005. The more I did it, the more comfortable I became. I was assigned to the Institutional Review Board to review research for the university, and I asked to review all the brain-related studies as part of my job. So that got me more and more comfortable reading the science. And at first I was reading drug studies, then it occurred to me I should see, are there other studies about diet and lifestyle, things that are under my control? And that's, when I started reading supplement studies in 2005, 2006, 2007. I discovered the Institute for Functional Medicine. I read their stuff. I've been reading the ancestral health stuff since 2005. And then in 2007, I'm like, okay, I'll integrate functional medicine, ancestral health, and all the basic science.
Right.
And it was breathtaking once I did that, and I leapt into, this is a very comprehensive, you do everything in your lifestyle that you can. It was stunning how rapidly things changed.
Thank you all for watching. I hope that you found the video informative. Please do hit the thumbs up button, subscribe to our channel, and hit the bell button for new video release notifications. It encourages us to continue to create more videos about anti-aging and extending healthy lifespan. Thank you so much for your kind support. I wish you all well and will speak to you again soon.